Hi, my name is Amy Cooper. This is my case study presentation for Nurse 4241, Servant Leadership. So, as a hospital administrator, it is my responsibility to address the current 15% turnover rate. This vacancy rate is expected to rise to approximately 20% in the near future, so it is my responsibility to create solutions and ideas to attempt to combat these turnover rates, reduce that, and retain our nurses. So this is going to require a combination of being a servant leader and using the relationship leadership paradigm, as well as a little bit of the industrial leadership paradigm. The very first thing to address is the current shortage of nurses. We need to very aggressively and rapidly fill these vacancies with travelers and agency nurses. Our current staff is overloaded at the moment. They are working short nurses and increased patient load. So it is imperative to go ahead and get these nurses and patients the support they need. Now, realizing this is a temporary fix, however, having these travelers in place for the next few weeks or in months will allow us to continue to put in place our solutions and recruit new nurses, experienced nurses, as well as hiring nursing students, new graduates, and giving an opportunity to train them before these travelers are set to leave. The next thing that we need to do as nursing administration is to begin doing daily rounds. This involves making connections, building trusting relationships with our staff, making contact with them on a daily basis to see how things are going, how things aren't going, and what we can do to make their workflow better. Is it a broken computer? Is it missing equipment? What can we do on a everyday, daily basis? Be right there with our staff. Can we get that patient a soda while you finish your charting? Let us know. We are here to help you. The next thing that we really need to do, along with these daily rounds, is create an open door policy. We want to encourage our staff to be a part of the solution, to always be able to come to us with cares, concerns, or problems or questions. We also want to encourage them as they're making these suggestions of things that need to be done differently. We encourage them to help make solutions and give them the credit that they deserve by helping team solve and come up with solutions. Instituting and creating and encouraging shared governance. We know that shared governance is imperative for nurses. It gives nurses the empowerment and the voices to be able to change and improve the way that they work and how that they are able to care for their patients. We want this on a hospital level. We want this on a unit level. We want to encourage our nurses to be more involved in their place of work. Another thing that we want to do is increase tuition reimbursement. Currently, it's only $5,000 a year for our nurses, and that comes with a 1-year contract. We want to increase that to $8,000 a year, but also bring that to a 2-year contract. This helps the hospital retain their nurses, as well as help increase the education of our nurses. We want to encourage them and empower them to continue their education, to gain more knowledge, and to earn higher degrees. We know that nurses with higher degrees are able to do more. They can provide higher quality of care, as well as empower and educate their co-workers. Nurses are more likely to stay within the hospital if they are supported financially, educationally, and have a team, a whole team full of quality, highly educated nurses at their back to support them. Also, providing exit interviews. When a nurse is ready to leave, we need to sit down with them and find, why are they leaving? Why are they not staying? What did we not do? What could we do better in order to retain our nurses? It's an educational opportunity for us as administrators. Other benefits and things that we can look into for retention would be increasing PTO, giving nurses more rest, more away, more vacation time in order to kind of regroup and refuel before they come back into work. Another major thing that we need to do is increase the recruitment. It's the next major step into filling these vacancies. We are working with local nursing schools to come to an agreement with one or two nursing schools to provide them with priority placement for clinical rotations for their students. This would include priority time slots, first serving to them, giving them priority. In addition to that, we would offer jobs as ancillary staff or like patient care techs to these students in order to begin gaining experience and knowledge, as well as being able to take advantage of the tuition reimbursement program that we are going to provide. We will also be expanding job fairs at local schools in order to do the same. Recruit new nurses, recruit new ancillary staff, and making those connections. Also, sign-on bonuses for experienced nurses. We really need to bring the experienced nurses in. We need to bring them in on a sign-on bonus as well as a contract. Having this added experience will bring higher quality, higher educated nurses and provide a better quality of care for our patients. Those are just a few of the things that we need to do to start improving our rates, and those are the things that I am committed to do to help my staff stay with us, grow with us, and continue to recruit and find new nurses. Thanks.